A hearty good afternoon to everyone, and welcome to a session How to Plan Your Pregnancy. We're pleased to have Dr. Sunitha amongst today to educate us on this topic. When it comes to planning your pregnancy, there are a few key considerations to keep in mind. Dr. Sunitha will guide us through the process and educate us on the necessary things to keep in mind. So, Doctor, you have the stage.
Hi, good afternoon, everyone. I'm Dr. Sunitha, consultant artist specialist from Apollo Fertility, Banjaras. So today I'll be discussing about a very simple and a basic topic, which is how to get pregnant. So because of the modern lifestyle, be it the sedentary lifestyle or the unhealthy food habits, the stressful lives, all these things have affected the fertility uh, considerably. And we have seen an increase in the infertility issues in our clinic on a daily basis. In women, we have seen more commonly polycystic ovary, and in the men, we have seen more commonly a lower count and motility. Now, it's important that couples who are planning to conceive should first try and understand what actually is happening in their reproductive cycles. First of all, let me try and make you understand that in case a woman is planning to conceive and both the husband and wife are healthy, the woman is having regular cycles. In such women, the percentage of them able to conceive is about only 20 to 25% per cycle. That is, if there is no fertility issues, she is having regular cycles and they are trying regularly during the fertile period, which is usually in a 28 to 30 day cycle, would be between day 11 to day 18, which is the fertile period. In this period, if the woman and partner are having intercourse, then the chances of the couple conceiving would be around 20 to 25%. And if they try for pregnancy over 6 months to an year, then their chances of conception would be around 80 to 90%. So this means we need to understand that if you're just trying, say, for 2 months or 3 months, and if you have not conceived, it is perfectly all right, and you should not get worried. It is possible that everything is absolutely fine with you, and it is sometimes nature has takes time for the pregnancy to happen. That is something we need to understand. Now, if a woman is having regular cycles, say 28 to 30 days, then the fertile period for the woman would be around day 11 to day 18. And this can be plus or minus 1 or 2 days depending on the patient's cycles. If they are about 30 or 32 days, it can be a little later also. And if she is having 26 days, it can be a little early also. And there can be variation from cycle to cycle. And it is important that around the time of ovulation, 2 to 3 days before ovulation and 2 to 3 days after ovulation, the couple should have intercourse so that their chances of conception increase uh, and they are able to conceive faster. This is very important. Lot of times couples plan their intercourse or sex depending on the menstrual calendar, and they usually try maybe 1 or 2 days in the whole month. This will not maximize their chances of conception. Now, how do we understand that the woman is ovulating or she's not ovulating? Now, if the woman is ovulating, at the time of ovulation, her basal body temperature can increase slightly. Now, this cannot be noted by your regular thermometers. There are special thermometers which will let us know the small rise in temperature, which is about zero point 0.5 to 1 degree at the time of ovulation. Then there also women also can notice that at the time of ovulation there is vaginal secretions or cervical mucus which is released, and this mucus is very thin, watery, and is elastic. So this also the woman can note, and then you can understand that this is the probably the ovulation time for the lady. Then there are also over the counter LH kits or ovulation kits, which we know as. These can also be used to understand if you are ovulating or not. Now, these LH kits may not be 100% predictive. There can be sometimes false negatives also with the LH kit. But this is one method of understanding what is your uh, day of ovulation, so that you can try and have intercourse either 2 to 3 days prior and 2 to 3 days later also, in order to maximize the chances of pregnancy. The other important thing, lot of the couples who come to the clinic, they regularly ask us, Madam, is it okay to have intercourse, say, just 1 or 2 days at the time of ovulation? Now, please understand, having intercourse only for 1 or 2 days, just at the time of ovulation, will not increase your chances of conception. Ideally, you should be having intercourse 2 or 3 times in a week, or alternate day or daily, especially during the fertile window period, in order to increase your chances of conception. The other question couples do ask us is, um, like, is there any particular position which will help us in increasing our chances of conception? Please understand, there is no particular position during intercourse which will help in maximizing the chance of conception. The other very commonly asked question by the ladies is, sh- after intercourse, should we lie down for some time in order to increase our chances of conception? Now, again, please understand that lying down for a long period after the intercourse will not increase your chances of conception, neither decrease your chances of conception. So, because the first few minutes is the time when the sperms would have entered the vagina and into the uterus, and lying down for a longer period will not increase the chances of conception. And the other question many times couple do ask us is it important to have multiple times intercourse at the time of ovulation? So it is not mandatory to have multiple times intercourse during the time of ovulation. You can have either daily or alternate day, the depending on your uh, whatever you are comfortable with. It's not mandated to have multiple times intercourse at the time of ovulation. You can have either daily or alternate days at the time of ovulation period or the fertile window. Now, these are very important things which couples fail to understand, that unless you try naturally and unless you have regular intercourse, there's no way that you will maximize your chances of conception. Using ovulation kits and the trying to check your body temperature or the vaginal secretions will help us try and understand whether you're ovulating or not. But that does not mean that is the only period you should have intercourse. Yeah. So the now coming to what is the important precautions a lady or a couple should take if they are planning to conceive. Please understand that having a balanced diet is very important if you're planning to conceive. This holds good even for the male partner also. Now, many times we have seen that couple who are planning to conceive do not seem to understand the importance of the nutritious diet in their regular day-to-day food habits. Vegetables and fruits are rich in antioxidants, and which will help in increasing the chances of conception as they improve the oocyte and sperm quality. While if you take processed food or junk food, they will have free radicals which can have negatively impact your fertility. Also, maintaining a healthy body weight or a healthy BMI is very important for the couple to conceive. We understand that women who are overweight or underweight can have hormonal issues. Their hormones may not be balanced, they can have irregular cycles, and their ovulation can be hampered. So it's important that in case your BMI is high or you are obese, to try and decrease your body weight in order to improve the chances of conception. Now, it's also important that if you are a person who is having a lot of caffeine, means taking a lot of coffee, or if you are uh, smoking or taking alcohol on a regular basis, it's important that you cut down all these habits in order to improve your chances of conception. Coffee, alcohol, and smoking, all these can impact the quality of the gametes, that is, the eggs and sperms, and thereby cause a decrease in your fertility. Now, a lot of couples in the modern lifestyle, they do not seem to have any exercise routine. They have very sedentary lifestyles. Uh, always, and many of the software employees seem to spend a lot of time in front of their laptops and do not seem to move at all. Now, this is again very unhealthy, and especially if you are planning to conceive, it's important that you have a exercise routine and have at least 30 to 45 minutes of moderate exercise. Please understand, it should be moderate exercise. uh, do not have a high intensive exercise routine which can affect your fertility. Now, coming to what is the what are the couple who are planning to conceive should be doing if they are planning to conceive? What is the approach they should have? First, having a, as I said before, having a balanced diet, and second is they should consult a gynecologist or a fertility specialist so that a preconception assessment is done and they're counseled regarding their diet, and if there are any medical issues they are identified. For example, lot of patients we have seen hypothyroidism is one very common problem. They also seem to have nutritional deficiencies like anemia or vitamin D deficiency. It's important these hormonal issues or nutritional deficiencies are corrected if they are planning to conceive. And at the same time, in case you happen to have had any medical issues, that is especially gynec related medical issues, it's important that you inform the doctor, especially if you had previous history of some sexually transmitted diseases, or if you had a history of any pelvic surgery for an ovarian cyst, or if you had any surgeries on the uterus. It's important that you inform the doctor so that they will do the necessary investigations in order to understand that your fertility is not hampered. At the same time, it is also important that in case you happen to have any previous medical disorders, say such as diabetes or hypertension, or if you are had any history of epilepsy in the past, all these medical issues can also have an effect on your fertility, and also the medications that are used can be uh, uh, can result in problems during the pregnancy also. So it's important that you inform the doctor so that the doctor can give you a safer medication so that uh, the newborn baby or the fetus does not get affected. Uh, so these are some of the precautions a couple who are planning to conceive should be taking. And other than that, we have seen a lot of women in the present uh, scenario. We have seen a lot of them are having polycystic ovary. Now, this is again a lifestyle issue because of the sedentary lifestyle. They tend to put on weight, and they also, due to which this condition of polycystic ovary has increased because of their unhealthy food habits and sedentary lifestyle. So it's important that if you happen to have irregular menstrual cycles, that you should consult the doctor get yourself assessed and rule out any polycystic ovary condition so that your fertility is maximized and so that you can conceive faster also. And if you are a woman who is more than 35 years, you should not wait for uh, 1 year of uninterrupted intercourse. You should consult a doctor after 6 months of uninterrupted intercourse in order to get yourself assessed and understand if there is any fertility issues, because age more than 35 years, the ovarian reserve can get decreased, the fertility chances can be lower. So you should not wait for 1 year to get completed. And if you're not conceiving in the first 6 months of your married life, it's important that you consult a doctor and not postpone your visit. Um, I think I have tried to make you understand what exactly is important for a couple who are planning to conceive, how they should. It's important that they take a balanced diet. It's also important that they consult the doctor. It's also important that they have regular intercourse, at least weekly, 2 or 3 times in a week, and especially during the fertile period, it's important that they have intercourse so that their chance of conception are increased. And it's also important that to understand that the at the time of ovulation, the egg which is released survives for about 24 hours, while the sperm can survive up to uh, 3 to 5 days. So having intercourse prior to ovulation is also equally important in order to ensure that your chance of conception are increased. So these are some of the things that you should keep in mind if you're planning to conceive naturally. And if you are unable to conceive naturally, say you have tried for an over a year, and you have regularly tried uh, over this 1 year and still you have not conceived, then it's important that you consult your fertility specialist or a local gynecologist. Get yourself assessed, where the doctor will be taking your complete history, your your history of your menstrual cycles, if you have any medical disorders, all these things the doctor will take a proper detailed history. Then they will suggest you the required blood tests or investigations, so that we try and understand why you are unable to conceive. Now, whenever a woman has been trying since for 1 year and still unable to conceive, then there can be multiple reasons. It is possible that the fallopian tubes can be blocked. It is possible that the woman may not be ovulating also. Now, it's important to remember that a woman can have regular cycles and still they may not be ovulating. So there can be problem in ovulation also, and sometimes there can be problem in the uterus. There can be fibroids, there can be polyps. All these can hamper your fertility, and these can be identified if there is a detailed fertility evaluation where an ultrasound is done, hormone tests are done to understand if there is any problem. Now, even in the male partners, investigations are done to understand if there is any medical disorders, and a detailed semen analysis is done, which will help us in understanding if the sperm count is normal or the motility is normal or not, or if the motility is decreased or the sperm count is lower, that also can hamper the fertility. So, whenever you have tried for 1 year and you are unable to conceive, it's important that you consult a good local gynecologist or a fertility specialist so that they can assess you correctly and give you a proper advice on how to plan your conception and what are the treatment options that are available in order to become pregnant. Hi, so I have tried to touch upon the very basic things about how a couple should plan their pregnancy. And in case any questions are there, you can go ahead and ask me, and I'll be able to answer the questions. Hi. So Pooja is asking whether uh, she has been given Meprid tablet and does it help in pregnancy? So, Meprate is medroxyprogesterone acetate, and this is usually given for women who have delayed menstrual cycles. So, this is not to help in pregnancy, but this is basically to ensure that you get a withdrawal bleed. But medroxyprogesterone is quite safe in pregnancy, and if you happen to get pregnant, in spite of being given medroxyprogesterone acetate and you later realize that you are pregnant, you do not worry. It is quite a safe medication and it will not affect the pregnancy in any way. So, okay. So, since there are no more questions, I would like to conclude this session. And if you happen to have any more queries or doubts, you can always uh, get in touch through email or WhatsApp us. We will be love to clear all your queries. And thank you for the uh, session. And we'd like to conclude the session.